While many Americans are doing their best to move on from COVID-19, shedding their masks, going back to the movies, sports arenas, other large gatherings, in some parts of the country, the pandemic is still raging. Nationwide, we've been recording around 20,000 new cases a day as the more contagious Delta variant overtakes the original strain of the virus, with certain areas of the country in deepening danger, as Dr. Fauci has warned.
I'm concerned as this variant becomes more dominant, those areas, those select areas of the country that have a very low level of vaccination, like 30% or so, you're going to start seeing mini surges that are localized to certain regions.
Among those regions is Mississippi, which is ranked second to last for vaccinations, with cases spiking by nearly 100% in just the past 2 weeks. And officials now urging everyone 65 and older there or with comorbidities to avoid all indoor mass gatherings. And even for the fully vaccinated, close to 50% of the country, and more than 60% here in Massachusetts, the future is still being debated. It's not yet clear when or if fully vaccinated people will need booster shots. Here's Dr. Fauci again, then former FDA Commissioner Scott Gottlieb.
There's a lot of work going on to examine this in real time to see if we might need a boost. But right now, given the data that the CDC and the FDA has, they don't feel that we need to tell people right now you need to be boosted.
That's a multi-month process. So if we don't get started right now, we're not going to be in a position to have boosters available should we need it come the fall.
Joining me to discuss where we are with COVID and why are Dr. Bhadelia, the director of Boston University's Center for Emerging Infectious Disease Policy and Research. Dr. Mark Siedner is an infectious disease clinician and researcher at Mass General's Division of Infectious Diseases. Doctor, good to see you both. Thanks so much for being here.
Thanks for having us, Jim.
Sure. Dr. Bhadelia, if I can start with you, I think my numbers are pretty close to accurate. 50% of all new infections nationally, Delta, 80% in some states, and about to become the dominant variant here in Massachusetts. Let's start in Massachusetts. More than one expert has said we have a Delta wall here, is the expression, because of the high vaccination, low infection rate. Do you share that perspective?
I do. I think we're in a better place than some of the states that you mentioned, Jim. But I think what you're seeing is that, another stat that I will share that CDC shared a few weeks ago is that 99% of the deaths right now are among unvaccinated. And so here, in Massachusetts, our cases have been pretty steady, I think about 100, right? And so we haven't seen an increase in cases, partly because I think to some level, the vaccines not only protect you from disease, but they're also helping decrease the transmission a little bit. But they're also blocking those hospitalizations and those deaths that are what we're concerned about as well, which would sort of put the strain on the healthcare system. So for now, we're fine. Here, I worry about inequity in terms of pockets of or communities, entire communities that may be still unvaccinated. That's where, within a state like ours that's highly vaccinated, those are the areas that you might still see surges in cases and potential hospitalizations.
Dr. Siedner, let's go even further afield and cross our border. I mentioned Mississippi, Arkansas is in the 30% range, explosions of the virus in Missouri, many other states. Why are we not talking about returning to the same sort of restrictions on interstate travel that we had many months ago? Why should we not be concerned in Massachusetts that a bunch of people are flying in from one of those states and planning on just hanging out here, potentially unmasked?
Yeah, well, the reason you're seeing outbreaks in places like Mississippi, Missouri, Iowa, et cetera, is because they have low rates of vaccination there.
Sure.
If people from Missouri traveled here, for example, as was just mentioned, because our vaccination rates are almost 80%, at least with one dose, most of those transmissions would not occur. And as long as we can continue high vaccination rates in this state, we will be lucky. The people that live in the state will be lucky because we are approaching something like herd immunity in the state. So even if it does get transported in.
Doctor, my understanding is we're only at roughly 60% fully vaccinated even here, which means 40%, we can all do the math, are not.
Yeah, so about 60% of people in Massachusetts have received one dose, but I'm sorry, have received at least one dose. I'm sorry, have received two doses.
Both doses,
or have been fully vaccinated. Yeah. Exactly, if you include Johnson & Johnson. But almost 80% of those eligible have received at least one. And so I don't think we have a complete wall of protection, but the reason we're not seeing outbreaks here, despite the fact that we know Delta exists here, is because we have a high rate of vaccination. And so even when transmissions occur, they do get blocked. They get blocked by the presence of what we have as herd immunity. Now, if immunity wanes, or if new variants develop in places like Missouri, or frankly, in most of the rest of the world, we have not vaccinated enough people, Massachusetts residents may no longer be protected. And so it is in our interest to make sure that people around this country and around the world get vaccinated, even if we have high rates here.
Dr. Bhadelia, I want to stay with around the country for a minute. I read today on Axios' website something that I thought was like a Saturday Night Live routine, that a bunch of Republican legislatures are considering treating unvaccinated people in terms of, quote, discrimination, like people of color, people of religions, gender, etc., saying that you cannot discriminate against an unvaccinated person. So, for example, like you can't discriminate against a black person, a person of a certain religion, as I said. So, for example, if a business wants to say only vaccinated people can come here, they would be violating state law. Am I overreacting to what I see as the insanity of this proposal? Montana, by the way, has already made it law. Other states is just pending. Is that nuts or what?
Since I don't know where to start, let me start with a place that's comfortable for me to start, which is the science of it, which is that in states where there are many, many vaccinated people, people who are unvaccinated have the cover because those around them are not going to be transmitting at the same rate. And there's less likely to be virus in the community, enough virus in the community. In places that are not as highly vaccinated, which, you know, you're clearly seeing a division across the country where right-leaning states, GOP states, are seeing lower rates of transmission. And that's where you're seeing increased cases. I just feel that politicization of vaccinations, you know, by many of our GOP politicians, I'm just going to be very frank, to me, it makes no sense from a public health perspective, but I'm trying to figure out how it makes sense from a political perspective, because you're leaving your constituents unprotected and they're going to get hurt. And that doesn't seem to be a good election strategy for me. But, you know, I'm just a simple infectious diseases doc. Okay,
so I'd say you're being, in a polite way, you're agreeing with me. I think that's what I heard through there. Dr. Siedner, if we can move to a couple public debates that continue in this country. I hinted at this before, the mask debate. There are a number of leaders who we respect who say you should wear masks in public places, even if you're vaccinated. There are a number of public leaders who say don't. Who's right?
Well, you know, there's more than one thing that determines whether you get infected. So vaccination is one of the most important ones. And I think that these decisions need to be made with a number of factors involved, and vaccination should be at the top of our list. But another thing that matters is how much force of infection there is in the community around you. So again, if you're walking around in Mississippi right now and there's a huge outbreak and you're immunosuppressed, even if you've been vaccinated, yes, I will tell that person they should probably have a mask on. This should not be, unfortunately, the messages are not binary. And so saying masks are always okay or they're always not okay is potentially actually confusing, but sometimes the way public health needs to deliver messages. But you can't just think about one thing. It's a combination of factors. Vaccination is extremely important. Now, if you're in the state of Massachusetts right now with 1 case per 100,000 incidents and you're vaccinated, I don't think the risk benefit is strongly in favor of wearing masks unless you have an immunosuppressing condition. But we can't use this one size fits all for every person.
Understood. Dr. Bhadelia, speaking of vaccinations, as you know, and I also touch on this at the top, there's a pretty major dispute, not just between people like Scott Gottlieb and Anthony Fauci, but between Anthony Fauci and the drug manufacturer Pfizer itself about boosters. Who's right there?
I think, you know, I heard that conversation, and those are two different discussions in some way, right? I think what Scott Gottlieb said in that is that you need the manufacturing capacity and the readiness. And sure, I agree. You know, let's have that. And in some ways, we're much better off in a lot of those venues than we were about a year ago when, you know, we weren't producing as much vaccine. I do think that scientifically, I lean towards what Dr. Fauci is saying, which is that for the most part, for most people, it seems currently we're still protected. If you've gotten 2 doses, you're fully protected. Delta variant does seem to decrease. You know, you might get more breakthrough infections, but you're still highly protected against hospitalizations and deaths. However, even now, today, among immunocompromised patients, we're seeing large number of people with even 2 shots, they're not able to get their immune system revved up enough. And there's more evolving data that shows that if you give them a 3rd dose, their immune response may go up enough to protect them more. In those cases, there's more evidence. For the general public, I think you're still waiting to see what that longevity of protection is like. And so we just don't know. And we also don't know what variants, new variants, just because Delta is still, protected, we're still protected against Delta, doesn't mean a new variant may not come along in the fall where we're not protected. And that's why I think it's hard today we don't need it. It's hard to know if we're going to need it down the road.
Yeah, one last thing. I only have 30 seconds for both of you. I'm thrilled that you're both more positive about this since you know what you're talking about as opposed to me. But ending on a negative note, Larry Summers runs this organization of G20 economies that came out with a finding that, forget how we're dealing with the current pandemic, that despite the lesson, we are wildly unprepared for the next one. Quickly, Dr. Siedner, you first. Is Summers right?
Absolutely. If we didn't learn after Ebola, we still haven't learned it now. If you just look at a global map of vaccinations, you can see we do not have the global system in place to protect people from epidemics. I hope we learn from this epidemic, but so far the news has not been promising.
Dr. Bhadelia?
Yeah, I think we seem to sort of cycle between panic and neglect, which is actually from another Larry Summers report a few years ago after the Ebola outbreak in West Africa. But I will say that we've incrementally learned a few things, right? I think COVAX, the utility that is not functioning well, brought a lot of cooperative action on the ground, and we can build on that. We just need the political commitment and we need funding, which is what we don't have.
Dr. Bhadelia and Siedner, I really appreciate your time, both of you. Thanks so much for being here.
Pleasure. Thank you.
Thank you.